Stop. Don't drink anything before bed tonight until you hear this. Because one common nighttime habit is quietly raising blood pressure in seniors, and most people are doing it without even realizing the danger they are putting themselves in. It is a silent, invisible threat that waits for the lights to go out. The worst part is that it happens while you're asleep. Most people never notice it until it's too late and they wake up wondering why they feel exhausted or why their morning readings are off the charts. You see, your blood pressure is supposed to drop at night. It is a natural biological process called dipping, where your cardiovascular system finally gets a chance to rest and recover from the day's stress. But for many people, especially those over 60, that dip never happens. Instead of resting, their heart is working overtime in the dark. This is the phenomenon of the non-dipper, and it is one of the most dangerous predictors of future health crises.
And if your morning readings are consistently higher than your afternoon ones, there is a real chance this is happening to you right now. Take the case of a 67-year-old patient I remember vividly. Let's call him Arthur. Arthur lived a normal, relatively healthy lifestyle. He wasn't someone who gorged on fast food or sat on the couch all day. He took his walks. He watched his portions. And yet, every single morning, his blood pressure monitor showed numbers that didn't make sense. Everything looked fine during the day. His doctor would check him at 2 in the afternoon and find nothing out of the ordinary. But something was going wrong at night. Arthur was doing everything he was told to do, yet his body was failing a test he didn't even know he was taking. He was frustrated and, quite frankly, scared. He felt like he was fighting a ghost. We looked at his diet, his stress levels, and his medication, but the answer remained hidden. We'll come back to Arthur because what we eventually found changed everything. You might think the culprit is salt. We've been told for decades that the salt shaker is the enemy of the heart. Or perhaps you think it's a lack of exercise or the lingering stress of the day following you into your dreams. It makes sense to blame these things, but the reality is far more confusing. Even people who fix all of that, people who cut the sodium to zero and meditate for an hour before bed, still have this problem. They do the work, they make the sacrifices, and the numbers still won't budge. This confusion is where many people give up, assuming it's just old age or genetics. But it isn't. The answer is almost certainly sitting in your kitchen right now. Some people drink a small glass of alcohol at night to relax. They think a little wine or a stiff drink will take the edge off and help them drift away. And honestly, it does at first, but a few hours later, while they are deep in sleep, their blood pressure can actually spike. Alcohol has a biphasic effect. It might lower your pressure initially, but as your liver processes it in the middle of the night, your sympathetic nervous system kicks into high gear. Your heart rate climbs and your vessels constrict. It is a delayed danger that is incredibly powerful because it hits when you are at your most vulnerable. Let me walk you through exactly what happens inside your body when you have that nighttime drink. You pour a glass of wine at 10 you feel relaxed. Your pressure might even dip slightly in the first hour. That part is real. Alcohol does have an initial sedating effect on the nervous system, but your liver does not stop working when you fall asleep. Around midnight, 1 in the morning, your liver is in full processing mode. And as it metabolizes the alcohol, it triggers a rebound activation of your sympathetic nervous system, your fight or flight system, the same system that is supposed to be completely quiet while you sleep. Your heart rate climbs, your blood vessels tighten, and your blood pressure, which should be at its lowest point of the entire day, surges instead. You are sound asleep. You feel nothing, but your cardiovascular system is running like it's responding to a threat. And it does this every single night. You have that drink. If this sounds like your routine, even occasionally, this mechanism is happening inside you. Now, here is where it gets even more complicated because it is not just alcohol. There is another drink sitting in many seniors' refrigerators right now that most doctors never think to ask about. Grapefruit juice. It seems harmless. It seems healthy. But grapefruit contains a group of compounds called phenylalanines. And what these compounds do is block a specific enzyme in your gut, CYP3A4, that is responsible for breaking down a long list of common medications. We are talking about calcium channel blockers like amlodipine and phenytoin, which among the most commonly prescribed blood pressure drugs in the country. We are also talking about certain statins and certain anti-anxiety medications. When you drink grapefruit juice and these drugs cannot be properly metabolized, one of two things happens. Either the drug builds up to dangerously high levels in your bloodstream, or it is rendered ineffective entirely. And the terrifying part is that this effect can last up to 24 hours from a single glass. You had it yesterday morning, and it is still interfering with your medication tonight. The cruelest irony is that the two drinks most likely to be sitting on a senior's nightstand, the glass of wine to unwind and the glass of juice to stay healthy, are the two most likely to be quietly sabotaging everything you are doing right. But those are not the only ones. There are two more that most people consider completely safe, and we are going to get to those in just a moment. Doctors often only catch this problem if they monitor your blood pressure for a full 24 hours using a method called ABPM. This is because during the day in the bright lights of a clinic, everything can look completely normal. You can walk into an office with a perfect 120/80, but that doesn't tell the story of what happens at 3 a.m. This hidden danger is why so many people suffer strokes or heart attacks in the early morning hours. Their daytime health was a mask for a nighttime catastrophe. Think about what that means for a moment. You have been going to your doctor for years. You trust the process. You roll up your sleeve. They put on the cuff, and they tell you everything looks fine. But the standard office visit is structurally incapable of catching this problem. It cannot see what happens at 3 in the morning, and 3 in the morning is when it matters most. Here is what the research has confirmed. Your blood pressure follows a natural 24-hour rhythm. It is supposed to reach its lowest point, what cardiologists call the nadir, somewhere between 2 and 4 in the morning. Then it begins rising again around 4 or 5 a.m. in preparation for waking. That early morning surge is a normal biological process, but in non-dippers, that surge starts from a baseline that never dropped. So instead of rising from a rested, recovered floor, it is climbing from an already elevated ceiling. This is precisely why the majority of heart attacks and strokes do not happen in the middle of the afternoon. They happen in the early morning hours. The cardiovascular system has been under pressure all night, and the morning surge becomes the final trigger. The OHAMA study, one of the most significant long-term blood pressure investigations ever conducted, found that non-dippers had dramatically higher rates of stroke, kidney damage, and thickening of the heart's left ventricle compared to people whose pressure dropped normally at night. This was true even when their daytime readings were perfectly normal. Normal during the day, dangerous at night, and their doctors had no idea. This is exactly what was happening to Arthur. His chart looked clean. His afternoon readings were unremarkable, but every night his arteries were under a pressure load they were never designed to sustain for that many hours. And that sustained pressure was doing damage that would only show up later in ways that would be much harder to reverse. We are about halfway through what I need to show you. We have covered the non-dipper phenomenon, the alcohol mechanism, the grapefruit problem, and what the research tells us about why those early morning hours are so dangerous. What comes next is the rest of the drink list, Arthur's answer, and the exact protocol that changed his mornings. Stay with me because this next part is where it gets specific. So we have talked about alcohol and grapefruit juice, but I promised you there were two more. And honestly, once I tell you what they are, you are going to understand why this problem is so widespread. The first one is caffeinated herbal tea. Now, I know what you are thinking. Herbal tea is the definition of a calming bedtime drink, and many herbal teas are genuinely caffeine-free and completely fine. The problem is that the herbal tea category has exploded in the last decade, and a significant portion of what is being sold under that label is not caffeine-free at all. Yerba mate, certain green tea blends marketed specifically as relaxing or detoxifying. Some energy-adjacent wellness teas, These can carry enough caffeine to measurably blunt your nocturnal blood pressure dip. And because the packaging says herbal, people never make the connection. They drink it every night for years, wondering why their morning readings are elevated. Check the label tonight. If it does not explicitly say caffeine-free, do not assume. The second one is going to surprise you even more. Fruit juice. Standard everyday fruit, juice, orange juice, apple juice, the drinks your parents gave you as a child, the drinks you have considered healthy your entire life. Here is the problem. A glass of fruit juice before bed delivers a rapid surge of sugar into your bloodstream. Your body responds by releasing insulin. And insulin, particularly when it spikes at night, triggers the release of cortisol, your primary stress hormone. Cortisol activates your sympathetic nervous system. It tells your blood vessels to stay constricted, and it does all of this while you are lying in the dark, thinking you are at rest. The sugar in that juice is essentially sending a biological alarm signal through your cardiovascular system at the exact moment your heart is supposed to be recovering. There are also two other categories worth mentioning. If you are one of the many seniors who have started drinking protein shakes or meal replacement drinks in the evening, be aware that certain high-concentration protein formulas can stimulate the release of norepinephrine as they are metabolized. The effect is mild in isolation, but if it is happening every night, it is cumulative. And sports drinks or electrolyte beverages taken before bed deliver a sodium load at the moment your body becomes horizontal. That sodium increases fluid retention and raises what is called cardiac preload, the pressure with which blood returns to the heart, not what you want when the goal is rest. So, let's name them all clearly. Alcohol, grapefruit juice, hidden caffeine herbal teas, sugary fruit juices, high sodium electrolyte drinks. Look at that list and think honestly about your own kitchen. One or more of these is almost certainly in there right now. Arthur was not doing anything dramatic. He was not drinking excessively or eating recklessly. He had simply fallen into a routine with one of these drinks, completely convinced it was helping him, and it had never once been flagged by anyone who was supposed to be looking out for him. Back to Arthur, he had tried everything. He cut out the extra salt. He walked 3 miles a day, and he was taking his pills exactly as prescribed. Still, the morning readings were high. We were at a loss until we looked at one simple habit. We looked at what was on his nightstand. It wasn't coffee, it wasn't tea, and it wasn't a failure of his medication. It was what he was drinking before bed. He had fallen into a routine that he thought was helping him, but it was actually keeping his blood vessels in a state of constant tension. His nighttime drink was the problem. Once we identified it, we made one specific pivot. We removed it. And then instead of leaving the habit empty, we replaced it with something that actually works with the body at night rather than against it. We introduced a small specific amount of beetroot juice. At night, your blood vessels should relax and dilate, allowing blood to flow easily with less pressure on the artery walls. But some drinks, specifically those high in hidden sugars or caffeine-mimicking compounds, keep those vessels tight and rigid. Beetroot works differently. It is rich in natural nitrates, which the body converts into nitric oxide. This gas acts as a powerful vasodilator. It tells the smooth muscle cells lining your artery walls to relax and open up, improving blood flow while you sleep and encouraging that dipping effect that is so crucial for heart health. It addresses the non-dipping problem at its chemical root, but the effect goes further than just vessel relaxation. Nitric oxide has also been shown to reduce platelet aggregation, meaning it helps prevent the kind of blood clotting that becomes most dangerous in those early morning hours when the cardiovascular surge begins. It also reduces oxidative stress on the inner lining of your arteries, the endothelium, which is the tissue that takes the most long-term damage from sustained nighttime hypertension. A landmark study published in the journal Hypertension by Capel and colleagues found that dietary nitrate supplementation produced clinically significant reductions in blood pressure in hypertensive patients with effects that were particularly pronounced during nighttime hours. This is not a folk remedy. This is biochemistry working in your favor. Now, here is the exact protocol. About 45 to 60 minutes before you plan to sleep, drink 4 to 6 ounces of pure beetroot juice. Not a beetroot blend with added fruit sugar, not a supplement that claims to be equivalent. Pure beetroot juice unsweetened. The timing matters because the nitrate to nitric oxide conversion process takes roughly 30 to 45 minutes to reach peak effect. You want that window of maximum vasodilation to coincide with the first few hours of sleep when the dipping process should naturally be underway. Do not add anything to it that contains sugar. As we discussed, sugar at night triggers insulin, which triggers cortisol, which directly counteracts the vasodilation you are trying to create. A squeeze of lemon is fine. A small amount of ginger is fine, but keep it clean. While you are building this habit, there are a few other things worth doing alongside it. If possible, sleep on your left side. This is not a minor detail. Left side positioning reduces the mechanical compression on the descending aorta, improves the efficiency of blood return to the heart, and has been shown to reduce the workload on the cardiovascular system during sleep. If you are not used to it, it takes about a week to adapt. Worth every night of adjustment. Dim your lights and put the phone down at least 30 minutes before bed. Screen light suppresses melatonin production, and melatonin has a mild but real blood pressure regulating effect that most people have never been told about. You are not just protecting your sleep quality when you do this, you are protecting your cardiovascular recovery window. And if your doctor approves, magnesium glycinate is worth bringing up at your next appointment. It is one of the most well-studied minerals for both sleep quality and nocturnal blood pressure regulation, and it is significantly underutilized in senior cardiovascular care. Arthur followed this protocol not all at once and not perfectly, but within 3 weeks of removing the drink that was keeping his vessels tight and introducing the beetroot juice at the right time, his morning readings began to change. Not dramatically at first, but consistently. The ghost he had been fighting for months finally had a face, and once you can see the problem clearly, you can actually solve it. This isn't about what you eat during the day, it's about what happens while you sleep. We focus so much on our waking hours that we forget that the heart never takes a vacation. It is a 24-hour organ that requires a 24-hour strategy, and it has been working for you every single day of your entire life without asking for anything in return. Look at what is on your nightstand tonight. Look at what you have been reaching for before bed, because sometimes the difference between a dangerous morning and a healthy one is not a new medication or a complex procedure. Sometimes it is one drink removed and one drink added. Fix your night and your mornings.